I'm Vicki Hogarth, and welcome to Southwest Magazine. Fresh off the heels of a Liberal policy convention and in the middle of a healthcare tour of the province, my guest today is the Liberal Party leader of New Brunswick, Susan Holt. Thank you so much for being here today.
Oh, it's great to be here. Thanks for having me.
I think this is your third time sitting down on this couch, so thank you so much for making the trip down to Charlotte County and taking time to visit us in the process. Tell us a little bit about the healthcare tour, and I know you were here in Charlotte County. That was the motivation for your visit today. Tell us a little bit about how it's going overall, and then also what you're hearing right here in Charlotte County.
Yeah, it's hard to say it's going really well because the stories that I'm hearing are really hard to hear. When people are talking about the heartbreaking conditions that they're facing as healthcare workers in the province, and you can feel the pain and frustration and sadness from people who aren't able to deliver the kind of care that they train to do, that they love to do. So that part's hard, but it feels necessary to really hear what's going on the ground from the people delivering the care. And so I'm really grateful to everybody who's come out and taken the time to share with me what they've experienced. It's been a lot of different things. You know, I've had people come out who are delivering long-term care, people who work in the hospital and everything from environmental services to surgeons to administrators. We've had nurses of all stripes, LPNs, NPs, RNs, who work in hospital and primary care in different settings. So gathering lots of information. Which was the goal. The goal was to really understand what's happening on the ground in different communities, because I don't have to tell you this, Vicki, not every community in New Brunswick is the same. There is different realities in different corners of our province, and so I wanted to come out and hear it on the ground from the people doing it.
Now, I know you were at Carmen's Diner specifically, where many people came out to meet you this morning.
Yeah.
What were some of the concerns you heard from Charlotte County residents?
A couple different concerns stood out to me. It all comes down to a lack of resources. There are good people working their tails off to care for New Brunswickers, but they don't have enough colleagues. The system isn't supported the way they need it to, and they don't feel respected. Whether it's the wages that they don't feel are competitive enough to attract anybody in to do this kind of work, whether it's the attitude that they feel coming from government that they're not worth a retention bonus, or that if people want to do something different, they can move to other provinces, that kind of rhetoric. I've heard time and time again. It was clear to me how hurtful that was because it's been echoed back. We hear people talk about infrastructure. We have aging hospitals, and so there's a lot of worry about what that means, and fear. A lot of fear that the Charlotte County Hospital is going to be closed. A lot of fear that patients are going to continue to have bad health outcomes because we don't have enough people to care for them. There was a real sense of agreement, consensus around the need for a primary care, multidisciplinary, after-hours clinic environment in St. Stephen particularly. They really saw both the opportunity, the demand for that, where they could bring lots of different practitioners together. It seems like everybody wants that to happen, from the doctors, the nurses, the mental health professionals, the physiotherapists, you name it. They see the need for something that is not just 9 to 5, that is not just an ER at the hospital, but a place they could go to get real team-based care, because they tell me that that's what people are looking for. There's a couple examples given of healthcare professionals that have left because policies weren't working for them, right? They didn't want to be a hospitalist and a family doctor, or the way that it was structured, they couldn't run their practice from the place that they had. And so administrative barriers, that means we're losing the kind of people that are going to care for New Brunswickers.
Are there key common threads from all the communities you've gone to, this is all across New Brunswick, that will inform your platform in this election year?
Definitely. I mean, two of them I've already mentioned, a real sense of a lack of respect. People want to feel like someone is listening because they see it every day on the ground. So I show up, I say one sentence, I open my notebook, and then people are pouring their hearts out because it feels like there's a pent-up desire to explain and be heard. And so that's been common everywhere, is that people really want to be heard and be listened to, and they want to feel like their services are respected and valued by their employer, by the province. So that's one. The understaffing has been consistent everywhere. People feeling like because they're constantly working short, they cannot give the care they want to give to people, and they don't feel like they're giving good care. And so they're going home guilty, traumatized, crying in their car after a shift because they know they didn't, that patient just wanted somebody to say hello to them and talk to them, and all they had time to do was deliver meds and run next door to the next patient. And so it was really sad. It's sad to see the pain on people's faces because they want to do different work and they know it's impacting the patients that they're serving.
Does it feel exacerbated post-COVID? Do we still feel like we're catching up to stabilize?
Yeah, I think that's part of it, right? I think we have a system that, we still have an increased amount of illness from people, whether it's COVID or flu or RSV or strep A, or like there's more things going around. There's also more of us. Our population has grown, and we have more people who are living longer and who have more acute conditions. So I've certainly heard in long-term care, I was visiting at Lincourt Manor, I was at the Passamaquoddy Lodge today, the needs of the patients and the residents there have increased. And so it takes more to care for them, and they need more equipment, more nursing hours, more medications, and that's adding to the complexity and the workload. And if you don't have more people, but you have more needs, then that's why people aren't getting cared for the way that everyone wishes.
I should, and this is a hyper-local issue, since you were just at the Passamaquoddy Lodge looking at aging infrastructure. What was your impression of that facility? And many of us in this community, my grandma was there, for instance, so a lot of memories there too, but definitely a need for an upgrade. What was your impression of the lodge?
Oh, that's exactly it, right? It's not an ideal, look, full credit to them, they are making the best of a bad situation because you can tell there's no space. We were in a room that was a storage room for wheelchair facilities. The stories of having to wheel someone out into the hall in order to be able to use a lift to transfer them to a wheelchair to make their way around the building is not, it's not a dignified way to spend your last years or months, I think is what they said their typical residence day is. It's crammed, it's expensive to deal with the maintenance of a 50-year-old facility that wasn't built for how it's being used right now.
I want to get into the policy convention, but since you're here in Charlotte County, what are you hearing overall from voters in this region about some of their top concerns going into what is the election year?
Yeah, there's a couple main concerns. Here in this region particularly, healthcare is loud and clear. In part, I think, because of the Charlotte County Hospital and people's worry that maybe it won't survive, as well as the frustration of having to travel to St. John because of all the services that have been cut, with no more maternity and no more labs and no more surgeries and that kind of thing. And we hear people wanting those clinics that have been promised a couple of years ago. We haven't seen any action. So there's a lot of frustration there and general fear of, if I get sick, is an ambulance going to show up? Is an ER going to be available? If I need care, will it be there? And then if my loved one needs long-term care, am I going to be able to find it for them? The other one that we're hearing a lot, and in this area I'll link it together, it's cost of living and housing. And those two things are quite related, right? Because people's rents are going through the roof, people's mortgages are getting more and more expensive. A lot of people can't find the place they need to live. And so then we're experiencing challenges that come with having a homeless population that has needs and the cost to serve. And then we're seeing an increase in mental health and increase in crime. And so now I'm jumping into a whole bunch of things, but the cost of living is really wearing people down. They're buying less and less at the grocery store. They're balancing between a power bill and medications and sending their kids to school with lunch. There's a lot of people that are on the edge, and they're making really hard choices.
And definitely when you live in a border community, I know it hits you more when you think about crossing the border and you want to support local. There's so many question marks in your head when these kind of prices rise the way that they are right now. I feel like I'm lucky to have you here today because not only are you on the Charlotte County leg of your tour, but you're fresh off the heels of the Liberal Policy Convention. I'd love to hear from your perspective. What were some of the takeaways from Saturday?
Oh, so many. I mean, I am thrilled with how it went because honestly, we were going in scared. Our members got so engaged in the policy process because we'd put it out to the membership. Anybody could volunteer, join a policy working group, come out to a public town hall. We did these virtual town halls where anybody could show up and share ideas, that we ended up with 75 resolutions on the table, which is twice as many as we normally have. But we can't keep people at a policy convention for 2 days. Like, who wants to come and sit and debate policy for 2 days straight? So we were really wondering, how are we going to get through all of these excellent ideas? The good news is lots of areas of agreement. So some of our best stuff never really saw the light of day because everyone agreed, and so it didn't make it to debate. It wasn't controversial.
And I'd love to hear what some of those are, because I know people have probably by Monday heard some of the more controversial ones.
Yeah.
But go ahead and tell us some of the...
We had 20 different policy resolutions on healthcare, particularly related to rural healthcare and ensuring access, to transforming primary care, to making sure that senior care is funded and so that people can have access to home care particularly. You want to stay in your home as long as possible, but home care is hard to find and expensive, so there were great resolutions on that. From an affordability perspective, we were talking about taking the tax off electricity bills to make life more affordable, reforming property taxes to make that work better, universal school food programs, breakfast and lunch, which both gets at helping kids be ready to learn and reducing a cost for families. So there was some really great stuff there that didn't undergo a lot of debate because we all agree it's the right thing to do, it aligns with New Brunswickers' priorities, and it's stuff that we think we can afford.
Okay, and then from, I guess, a more controversial point of view, let's talk about something like glyphosate. Your party is taking it on as something to look into. Can you elaborate a little bit on that?
Yeah. I mean, there is a debate about glyphosate that's been going on in the province for a while, and our party is probably pretty reflective of that. We had people who brought forward a resolution to put forward an immediate ban on the use of glyphosate, and then we had members who wanted to amend that because either they worked as farmers and they see the necessity of glyphosate to help manage their crops and produce food, and so there was amendments back and forth to both take away the immediate ban and move to language like address, but then also to expand it beyond glyphosate to all pesticides and to look at what is the impact that all of these types of chemicals are having on our environment, on our agriculture, on our forestry, and on our people, most importantly. So that one went around quite a bit, right? There was a lot of debate, different suggestions of amendment. Should we go this way, add this language? What if we take this out? What if we put that in? Is that strong enough? Is it comprehensive enough? One of the things I loved about the weekend was I thought it was a great example of what politics should be, right? People were coming up to the mic, disagreeing with each other respectfully, recognizing the other person's point of view, offering an alternative, right? Getting to a place where we could all agree on something, and so there was a consensus point to move forward. Right? That's not how it works in the legislature. So it was nice to see a really passionate, informed, but respectful debate on these ideas at our convention.
Proof that they can still happen. How wonderful.
Sometimes. I mean, we're like a big family, so it was reassuring to see people really caring for each other, even though they disagreed.
Abortion access, I hate to call it a controversial topic. I don't think it should be, but it's something that the Liberal government would be looking to make more accessible in New Brunswick. I'd love to hear how it would differ from where we're currently at now, and why, from your perspective, where we're at now with abortion access is problematic.
Well, not everybody has access to abortion, even like people who need it for medical reasons and for serious reasons, because it's something you can only get in a couple places in New Brunswick, from Bathurst and Moncton. That's not close to folks here in Charlotte County, and so to have to travel, the cost of that can be dangerous depending on how urgently the need is. It's really not accessible, and it's basic health care. So we want to repeal 8420, which is what treats abortion differently, and then it excludes it from our Medicare and our financial system. We don't know why you can have a cataract surgery or a hip and knee surgery out of a hospital, but you can't have an abortion out of a hospital in New Brunswick. You can have a vasectomy out of the hospital, but you can't have an abortion out of the hospital. So we think that needs to be repealed. And then we think there needs to be both education on the options, because there are more options than some people think. One of the great things the last government did was make MIFI covered by Medicare and the program, such that New Brunswickers now use that solution more than any other province. I think we're up to 66% of abortions are medical abortions rather than surgical. But people aren't aware that they can get that from pharmacists and doctors all over the province. But that doesn't meet everyone's needs. Some people need a surgical abortion urgently, and we need to make sure that we're keeping them safe and providing that care.
And outside a hospital setting is not abnormal in other provinces.
No, this is something that exists everywhere else, and New Brunswick has just been slow, I guess, to make the changes required, and I know we've been penalized for that through the Canada Health Act, that we aren't delivering the services that we are meant to be delivering. But we'd like to change that so that it's the same as everywhere else, that it's a regular piece of healthcare that you get access to as needed.
From doing my job here, I have heard stories from people in this community, which would be a good 3 hours away from access, so it definitely would make a difference here. I want to talk a little bit about Policy 713 and how it related to the convention, and what your takeaway was from Saturday.
There was a resolution on Policy 713, and I will have to see if I can remember the exact framing of it, because it was one that was widely supported by the membership, and so it didn't get debate or amendment. I think it was that we would adopt the recommended policy as drafted by the Child and Youth Advocate, because back in the summer, the Child and Youth Advocate did a bunch of research and reached out to all sorts of people and presented the legislature with work that had evaluated both the legal aspect of it, the health aspect of it, talked to doctors, child psychologists, professionals who deal with the people for whom Policy 713 was written to serve. And so our membership adopted that we would put in place the policy as per the Child and Youth Advocate's recommendation.
How does everything that happened on Saturday go into informing your platform going forward?
It's a big piece of input, right? We take how our members feel about things really seriously. I mean, that's how a Democratic Party works, is that your members have a say, they vote, they direct me and our caucus on how they want to see things move forward. So what happened on the weekend is a big input into our platform. We're also meeting with stakeholders, and we're meeting with folks who aren't members of the Liberal Party, like the healthcare workers that I chatted with at Carmen's in St. Stephen this morning, and the people that I met at the Passamaquoddy Lodge, and the people that I'm going to meet in Sussex tomorrow. All of that input comes in to help us make sure that we understand what's happening on the ground, what policies can really make a difference with the real problems that communities and New Brunswickers are experiencing. Because sitting in an office in Fredericton, there's a disconnect, I guess, between what's real in community and what might work here. And I probably don't have to tell you, what works in St. Andrews doesn't necessarily what works in St. Quentin, right? We have to have that local feel in order to put the right things in a platform and in order to govern for every New Brunswicker.
This St. Croix riding, we also cover Fundy the Isles, St. John West here at CHCO. Two ridings, though, that go Conservative, Liberal, or right down the middle sometimes. What are your feelings from speaking with voters in these two ridings about what they're feeling going into this election? And do you think these two ridings are, I guess I'll use the word flippable?
I mean, what I'm hearing from people here is a lot of frustration. A lot of frustration at feeling neglected, like nobody's listening. I think we saw that with what St. Stephen experienced, with people experiencing homelessness there, where the numbers were put forward, it was flagged as social development. There's a significant problem here. There wasn't action coming at all, and then when they got to a state of emergency, the response from public safety and social development was not respectful. So I think that's an example of what I hear from a lot of folks is we feel forgotten. We feel like nobody cares. Certainly when you go to Grand Manan and they say, we've been looking at getting, air ambulance service for a year, I think, and it's like nobody cares that we are in a very precarious situation. Believe the minister might have finally gone over there and put something in place, but they had to scream from the rooftops for somebody to pay attention. So that's what I'm hearing, is it feels really left out. People feel like that nobody cares in Fredericton or in the Premier's office. And so I think that kind of frustration does create an opportunity for change. I think a lot of people want things to change because they feel like the bottom line, like the province's bottom line, is more important than their healthcare. Right? Like, where we think it's more important to pay off the debt as fast as possible while the roof is leaking than to provide basic healthcare services to New Brunswickers. And if you pay off the debt as fast as you can, but you've got a leaky roof, your house is going to be worth nothing. Like, we should be able to patch the hole in the roof and make mortgage payments. And our team thinks you can do that you can deliver services to New Brunswickers and you can pay down the debt. It's just a matter of balance and care.
We were all expecting an election call back in November, an early election call. Does it look like we could see one this spring, or?
Oh, look, I mean, the Premier can be unpredictable. We don't know. There's been comments made that suggest that there could be an election this spring. And we did see it, right, last fall when the bus got wrapped and the logo got decided upon and they were ready to go and then changed their mind at the last minute. So we are ready for anything, I guess, and whether that's an October election or an election this spring.
Do you think it's to your advantage in a way that there was speculation that it would be early? You were
Oh, yeah. Yeah, it did help us because it galvanized people to say, okay, if this is happening, we need to decide if we want to be candidates. We need to get fundraising. We need to get the ridings in order. So we held all of our AGMs and we did more rapid recruitment than we had done. We got the core of a platform together back then. Like, if we're going to have a snap election, we need to be really clear about what we're going to do for healthcare, how we're going to make life more affordable, how we're going to address the housing crisis. Let's get really tight on tangible things that we can offer New Brunswickers. So yeah, it helped us move really fast and cover a lot more ground than we might have otherwise.
For those people who are on the fence about even voting, and that sadly happens quite a lot, what would you say are the key reasons that people should be going out to the polls in the next election?
I mean, well, first off, I can actually understand it, why people are fed up and thinking, why should I bother voting? You're all the same, right? It's just, like you said, red, blue, it flips, it flops. Do we get anything different? So I think where some of the change needs to happen is on our side, right? Politics needs to change. Politicians need to change because nobody trusts anymore that we're going to do the right thing and have their best interests at heart. And so we need to behave differently, which to me means go out to the coffee shop in public, sit down, be accessible, take questions, listen to people authentically, hear what they're telling you. I do these online Q&As to just I'll take any question from anyone, not screened, not scripted, because we need to build authentic connections with people and we need to be listening. So I can understand why people say why bother voting, except that if regular New Brunswickers don't vote, then we're going to get something that looks like either the angriest among us or maybe the people who benefit most from the system. And I don't think that serves us. Like, we need everyone to vote so that the vote really reflects what New Brunswickers care about, who they're willing to trust, and what they want to see their government do for them. Like, get out of Fredericton, get into my community and provide me with government services that will make my life, healthier and more affordable in a way that's realistic for where I live, whether that's Grand Manan or whether that's St. Andrews or Campobello or Macadam or you name it, right? We need people to participate and to vote if they want to get that outcome that's really going to reflect their neighborhood.
If you are the next Premier of New Brunswick, what are some of the first things you'll tackle in office?
Well, I don't want to sound like a broken record, but it's healthcare, right? If people can't get emergency care when they are at their sickest, then we have a problem. And to me, it actually starts right back at primary care, right? People should be able to, in their community, go and access a clinic with a team of healthcare professionals at early hours, late hours. If we can get primary care right so that everybody has that family doctor, nurse practitioner, LPN, mental health counselor team looking after them and their family, then the pressure on the ER lifts. right? And then we don't have the same sort of challenge in hospital. So that's a big one. And then there's cost of living measures. We've committed to taking the provincial tax off your electricity bill, to putting a rent cap in place, to doing property tax reform, because this crunch that people are feeling, the hard choices that they're making is not serving us either. So we want to move quickly to put affordability measures in place. Look, I could talk a lot about what we want to do on housing and what we want to do on education. I haven't talked very much about education. It's the thing I'm probably personally most passionate about, because I've got 3 daughters that are in primary school and middle school. And in an ideal world, if you get education right, then you have less healthcare problems, right? You give kids a great meal, breakfast, lunch in school, help them learn to read and do math. If we get that right, then those people go on to become our nurses and our doctors and our healthy citizens and the people that are really serving the rest of us. So I wish education was more of an election issue, because I think it's actually long-term the thing that will help make society better.
And as we get into, I wouldn't say the final stretch yet, but as we get closer and closer to that election, what are the challenges ahead for you and your party leading up to the day New Brunswickers go to the polls?
Yeah, lots of challenges. I mean, we already talked about the cynicism, right? Getting people interested and, you know, paying attention, I guess, for lack of a better word. A lot of us vote the way we always have, or the way our parents did, and when you want to make change, we want to change the political culture. I want to change the political culture of the Liberal Party and then of New Brunswick, but that means people have to be engaged. But when you have bills to pay and parents to look after, or kids to look after, and your job to do, maybe your second job to do, who has time to learn about the political parties and the candidates running? So breaking through and connecting with people is one of the biggest challenges. And then convincing people to go into politics at a time when it does not look like doesn't look like a dreamy job to a lot of people. We need good people in politics. We need different people in politics. If we're going to make different decisions in the legislature, it's not going to be with the same crowd of lawyers of a certain age, or we need the legislature to reflect the diversity of New Brunswickers, whether they live rurally, whether they've worked as teachers or nurses, or worked retail, or worked as accountants and lawyers. We need that diversity in the legislature. So convincing people to go into politics is one of my daily challenges.
Finally, you mentioned mistrust that people have towards politics. We're not immune to this in the media either. How do we rebuild this trust?
I'll tell you how I'm trying to do it. Maybe time will tell if it's working, I guess. You have to show up consistently. You have to be open and authentic, right? Like, that's why we're trying to get away from scripted. Like, I want every one of our candidates and people to speak from the heart. Tell us how you really feel, right? Like, don't say what I'm telling you to say. Answer your constituents' questions with how you really feel. Be human. Admit when you've made a mistake, right? Say, oh, you know what? I don't know. This could be better, or we screwed up there. That kind of humanity, I think, is what will build trust. Showing up time and time again, being authentic, and being honest about what you're trying to do. I don't know. That's what we're going for, is trying to get out there and be accessible and connect with people at a grassroots level to try and earn trust. By showing them who we are and asking them to give us a chance.
Well, I appreciate you showing up for Charlotte County and coming here for it. It's the 3rd time already in a year and a half. I appreciate it so much. Thank you.
I look forward to the 4th time.
My guest today has been the Liberal leader of New Brunswick, Susan Holt. I'm Vicki Hogarth. Thank you for watching Southwest Magazine.
Southwest Magazine is a news and public affairs production of CHCO Television.